Ne znam da li se čujemo i vidimo. Dobar dan svima. Evo samo malo da se namestim i da najavim jednog specijalnog mog gosta. Moram da kažem da će ovaj live biti na engleskom, tako da ću da vas zamolim, znači ukoliko razumete, ostanite, naravno, možete pitanje da mi postavljate i na našem jeziku, pa ću ih ja prevesti njemu, znači ako ne želite, ako budete pisali pitanje na našem jeziku, a onda ću da nakon ovog razgovora dodat ćemo titl, znači dodat ćemo prevod, tako da ako ne razumete dobro engleski ili ne možete da pratite, znači, eto, važno mi je da odslušate taj video i zbog toga će posle biti na mom profilu Hormonska veza on sa prevodom. Znači, to ne možemo sad dok razgovaramo, već ćemo to da uradimo tek kad budemo sačuvali ovaj video. Tako da, eto, ko danas ne razume ili hoće još nešto da ponovi, nije mu jasno, neka se priključi kasnije, to jest neka odgleda kasnije. Sad samo ja da pozovem ovo što znači prvo hvala vam što ste svi tu. Mnogo interesantna tema, naročito što na našem području uopšte nije toliko rasprostranjena i mislim da puno ljudi, evo ga Greg, znači prelazim na engleski, tako da se, a ukoliko se ne razumemo se večeras. Hi Greg, sorry for this short introduction.
No problem.
Short introduction was because my profile is not in English. So for that reason, I just explained that the title of our conversation will be, subtitles will be after I save this video, so after our conversation. So welcome to my profile and thank you so much for joining me today. Thank you for your time. I know we are in different time zones and I'm really keen and curious to hear from you why you're there and are you on the source of this topic. So yeah, I will start maybe with asking you to tell us how is that you're living in Taiwan and how you dedicated your life to this topic.
Oh, sure. Thanks for this short introduction. Let me make sure you can hear me okay.
Yeah, perfectly, all great. So if the question come in the meanwhile in my language, I will translate it to you. So please feel free, everyone, to write also in our language if you don't feel comfortable to write in English. But yes, we hear you great. So tell us what are you doing there and how is that you dedicated your life to this, to traditional Chinese medicine?
Okay, well, I'm originally from USA. I'm born in Arizona and lived most of my adult life, or a portion of it, in California, where I ran a traditional Chinese medicine clinic for many years in Orange County, and I still have a clinic in San Francisco downtown.
Oh, nice. Mm-hmm.
And I started studying Chinese medicine because I was introduced to it very early as a martial artist. Most of my teacher that I studied with were experienced in traditional medicine. So I saw it from kind of like the injury point of view first. I got to see injuries being treated and it was very cool at that time. And so I just wanted to study the traditional Chinese medicine. And I did that after I started college and I studied pre-medicine. Then I went into traditional Chinese medicine. Well, eventually I ended up here in Taiwan. My wife is from here, and I've been living here for about 7 years. And I've been involved with the Chinese medicine industry, the herbal granule manufacturing with Sunten most specifically, for about 25 years, both in the US and in Taiwan. And I'm also involved here in academic research. I'm a researcher here as part of the things that I'm doing here, involved in acupuncture science, and I'm also a consultant practitioner at the same time. And that's what I'm doing in Taiwan, basically. Yeah.
Nice. So you're between US and Taiwan, actually. Yeah. So you're traveling back and forth. So it's
Yeah.
very common thing to do. Yeah. I know in US, it's traditional Chinese medicine is really, really well developed. I used to live also in New York City for a while, for a couple of years. So I got in touch with this topic there, and I was impressed really. So let's explain for people, because in Balkans, in this region where I am working, it's not very well known, and actually that's medicine. We have to really introduce it in a way how many thousands of years of practice are there, and I would like you to explain us, like, how old is this medicine, where is it coming from, is it complementary with the modern medicine, and how it's treated in US and how it's treated in Taiwan.
Mm-hmm. Well, the medicine itself goes back really far. I think the oldest evidence is from the Neolithic age, and that's bone and stone needle, and even some kind of like herbal residue that goes back as far back as possibly to 12,000 years, which is very, very far. But then the written history of Chinese medicine will go back to about 2,500 years, where you see it described in some historical books, and also the first written account dedicated to traditional Chinese medicine, the Yellow Emperor's Inn or Canon, is approximately around 2,500 years ago. So there's an estimation of 2,500 years with evidence, and then up to 12,000 years basically from like archaeological specimens. So it has a long history of oral transmission. But in the United States, traditional Chinese medicine, I think, kind of got started around the 70s, 60s or 70s. It really got going following a visit by President Nixon to mainland China when one of his aides in mainland China was sick, and he got treated there. This was kind of a time in China where Chinese medicine was developed kind of strongly, and he got good results, and there was a big interest. They brought that information back to the US, published it in the New York Times. People took interest, and then it developed from there. And now currently, traditional Chinese medicine is basically a primary healthcare therapy that you can use, and it's highly structured. You can take a state board exam. They have a California state board exam, and they have a national board exam. And you can practice independently in a private practice, or you can join a group and work in a group. And each circumstance might be a little different. In Taiwan, obviously Taiwan is a nation very closely associated with pre-communist China. And so the Chinese medicine has developed here from the very beginning of Chinese immigrants coming to Taiwan. But currently it kind of has two lines, I would say. One of them is doctors who are here from China, or people that learned maybe like an old-fashioned apprenticeship style, and they've set up themselves as traditional Chinese medicine doctors. And there's another line where people are learning Chinese medicine mostly through university system, getting a degree, and then getting licensed for that. Those doctors can utilize the national healthcare insurance here openly, and Taiwan has a really great health insurance policy. And yeah, so almost there's many outpatient clinics, and there's a lot of hospitals that have full integrative Chinese medicine care. So as the infrastructure in Taiwan is more developed than the US.
Yeah. Oh, wow. I've been to China. I've never been to Taiwan, but know some people, and I know that it's impressive there, and I'm looking forward to that. Okay, so let's just explain for common people, like, do they work together with the classic, with the modern doctors of modern medicine, or they work completely separately? Do the people usually tend to go to traditional doctors, or more to medical doctors? I would be really curious to see that, to see how is it developing now. I mean, traditionally, of course, it was a traditional medicine, but now, since it's developing in a different direction, of course, for the last century, let's say. What is the situation? How the normal Taiwan person or Chinese person, when they're sick, where do they go? Where do they look for remedies and for solutions?
There's a variety of methods, and it depends where you're at. In here in Taiwan, basically a person can choose to go to an outpatient clinic, and there's many of them. In fact, just right around my area, there's probably 4 or 5 or 6 clinics right here, and you can enter and become a patient there. And if that doctor is registered with the National Healthcare Insurance, you can use your insurance card and pay a very low copay. So they're very busy clinics. Um, and you can also go to some of the hospitals that are set up for integrative care. And in China, there's even more hospitals with integrative care. There's many hospitals in China. And in the United States, mostly it's going to be outpatient clinics, privately owned clinics, and there's a few groups. That's pretty much where people go. But with that said, there's plenty of kind of under the table doctors in all 3 locations, people who learn from their grandfathers. And sometimes people will prefer to go see those old fashioned doctors, and those doctors are a little bit off the grid. So you have a couple different streams of people and where they go. Yeah.
I
But
was lucky to meet some person from UCLA actually that runs at the university. He runs the whole department for traditional Chinese medicine. So I was like, I know US is far comparing to Europe in that sense, but yeah, I'm sure that people have both options. So one option doesn't exclude the other. Yeah. So of course, if we have a problem, we're looking for answers simply everywhere where we can and what we can get. What I would like to explain also people, because usually people are a bit confused with the fact, is it the acupuncture, the Chinese traditional Chinese medicine, or it's traditional Chinese medicine and something else? So maybe let's say how traditional Chinese medicine, what are the ways they use, or tools they use to treat people?
Yeah, it's a good question, and it's actually worth explaining just a little bit. The term traditional Chinese medicine wasn't really developed till like more modern history. It's kind of following the 1950s, more of like the communist era of China, actually. So when there was a unification of the language in China, there was also a unification of traditional medicine, and that became to be called the traditional Chinese medicine, TCM. Prior to that, actually, this quite diversified. There's not just one lineage of Chinese medicine. There's multiple lineages of them, and acupuncture has always played a role in traditional Chinese medicine. So if you want to know how they fit together, it's really important to know that actually China is a massively huge country that's been developing Chinese medicine in different regions by different groups of people for a long time. Some areas were more prone to doing acupuncture, other areas might be more prone to doing herbal medicine. Some of them did them both. But it finally got unified together where most practitioners now use them interchangeably, and the average Chinese medicine doctor will choose which modality to use. They're both part of traditional Chinese medicine. It's just one of the therapeutic modalities at this point that can be chosen by the practitioner, depending on how they want to treat their patient.
Mm-hmm. So, except of acupuncture, there are other ways like I mean, some remedies, teas, or what else do you use when not acupuncture?
They use herbal medicine, of course, and there's the single herbs, there's formulas, there is other kind of physical type of modalities. So they call tuina, which is a form of remedial massage, a kind of orthopedic um, kind of adjustments style. They call jungu, like straightening the bones, is quite advanced. They can treat the fractures by hand. They can treat boils and abscesses and all kinds of sores and infections. And they call this external medicine. And they can use externally applied medicines. And there's qigong, and there's other kind of modalities called the guasa, which is kind of like a scraping technique. And scraping without cutting. It's just like friction on the skin. And there's moxibustion, there's cupping, and a lot of different kind of techniques that's been developed.
Mm-hmm.
Many of them.
That's very interesting, actually, to know, like, depending on practitioner or depending on simply their knowledge, or how long is possible. I mean, how long is needed to study this topic in order to treat a patient that comes with no diagnosis, for example, just with some chronic condition or some pain or some problems, and actually how long you need to study this in order to find the right solution for them?
Yeah, I think that the typical course of study will be about 4 years. It might go up in some places to like 6 years. There's some kind of shortened programs too that maybe not quite as comprehensive. So the average, I would say, is about 4 years in a university setting. If you are studying as an apprentice, which is the traditional method, it could be much, much longer, 5, 10, 15 years or something like this. So I would say anywhere between 4 years to 10 years might be an average, depending on your
Must be always
circumstances.
something new to learn, because I'm a naturopathist and I know it's like every day I learn something new. So I'm sure it's long tradition, and there are a lot of schools, different approaches, that it's always something for you as a challenge to
Yeah.
discover. I'm sure about that. Yeah, for sure. So what would be great to know, for example, what are the conditions you, in your experience, of course, treat the best? What is something that you can say, like, okay, this is done in very short time comparing to the modern medicine methods? What is something that you would say, like, if you have a problem, this, and that, come to me, I can solve it within, I don't know, 5 sessions? Or, I don't know, like, you can tell us how long is needed also to treat the patient for this condition.
Yeah, it's a bit circumstantial to each patient, of course, but there's some conditions that seem to respond very well, and either we can say it quickly. So there's also some special terminology that might go along with these kind of patterns of disease you might not be familiar with. But for example, there's many patients. You probably saw this in New York. It's definitely the case in San Francisco, but people that are very busy working and they're very stressed, but at the same time they're anxious, they're tired, they're stressed out, and they're fearful of losing their position or job because the city they live in is just almost unaffordable. So they're always on edge. This kind of patient will often work very hard and don't sleep very well, and then they may possibly be exposed to like cold weather when they're not really feeling very fit, and they're a little bit vulnerable, and they'll get a little bit sick and run down. So this kind of case will present itself very often in those kind of cities as a case of anxiety, nervousness, poor sleep, insomnia, stressed out, and all of those things. And there's a theory in traditional Chinese medicine, what we loosely called running piglet syndrome. Running piglet syndrome is a metaphor from agricultural ancient China, where a person would be living in a rural area, and they might like play with the little piglets, and they would run up your chest, and they would just use this metaphor to describe something like a psychosomatic sensation of something rushing up to your throat that people will feel. Nowadays they call this mostly psychosomatic sensations, but in traditional Chinese medicine they still call it running piglet syndrome. This kind of condition responds very, very well to traditional Chinese medicine, and it's a huge portion of your patients that you will see. No, doesn't matter what their presenting complaint actually is. This is a mechanism of disease that's very commonly presenting in very many of the patients, at least in the United States. And you can pretty much count on the results, very quickly with both acupuncture herbs and that kind of case. And there's many more. Pain syndrome.
We're definitely coming to a conclusion that so many diseases are having stress as a source of the problems. So many diseases. So I think today it's more obvious than ever, actually, that this is a strong factor. So if we can manage that, I'm sure that we can manage the manifestation. For example, where I studied in Germany, in Austria, naturopathy is like born there. So there is still in the classical hospitals, there are still departments of psychosomatic. Like you have psychosomatic departments where they treat patients. So I think it's really a huge part, and today it has such a bad connotation of being like something that you imagine, it's not real, or so I think it's really, really important topic to talk about it, and to see that acupuncture and that TCM can solve this problem and can address this problem, and maybe treat that way, like the symptoms. Okay, so my topic is actually what I'm doing most of the time. I have some women association and I'm mostly into women health. So in reproductive health and everything actually that one woman faces from her childhood till you know forever actually. So I know that there are a lot of women following us now, so I would like to address this topic as well and see how the traditional medicine, Chinese medicine and acupuncture or herbal medicine, how they can help in these conditions. For example, what we see that there is a raise in unfulfilled pregnancies, for example, and I see that in my work in the last couple of years, that the amount of women who don't have any diagnosis and have no problems, medically speaking, basically cannot fulfill that wish. So is there any solution? Is there anything the Chinese medicine
Oh
would
yeah.
say it's a better approach than the modern one?
Yeah. It's a very big part. It plays a very big part in a Chinese medicine clinic. You know, female health, female wellness,
Yeah.
gynecology, and fertility. It's a I think the statistic in U.S. and I think it's the same in Taiwan and probably in China and Europe too, is the average patient will be a female around 40 years old, 35 to 45 years old. This is a very common patient demographic. And many of their complaints are going to ultimately be related to some form of female health, gynecology, hormone problems, or fertility. And Chinese medicine is really geared very well to handle these kind of issues. It's actually a subspecialty within traditional Chinese medicine. There's people who specialize only in treating female health or fertility. Yeah. And it manages it very well because of the methodologies that's used in diagnosing patients. And then the treatments that are used can be very specific for what they see in terms of what I might call like an imbalance in the female health. So it's very applicable. It gets good results in most of the cases. Myself, I've had good fortunate outcomes with fertility, pretty consistently with Chinese medicine, and I've also had I've seen very good results with pretty much all forms of women's wellness if it's diagnosed well. Mm-hmm.
Mm-hmm. So what you're saying is actually that what I heard. What you're saying is that they're actually they don't find the right cause. Actually, why is this happening? That doesn't mean that there is no problem. Yeah. So it's just that we don't have the diagnosis. We didn't recognize it through our blood exams or whatever is the classical procedure to check somebody's fertility. Yeah. So there must be always a hidden cause, and this is easier to treat with the Chinese tradition. Is it necessary to treat it with acupuncture, or this is also the herbal medicine that is helping in this case?
Well, actually, as it turns out, there's doctors who specialize in their own modalities. There's doctors who like to use herbs, and there's doctors who like to use acupuncture. Both of those groups will have patient bases, and they're both treating conditions from random patient bases. So you can use either one, depending how the practitioner interprets the treatment. Most practitioners use a combination of both, actually. And that is determined by the kind of disease that they identify for that patient. And this is in Chinese medicine, in the Chinese medicine world, we call this a pattern identification based disease, basically. So you get to look at the patient and do a different type of intake, a different kind of assessment, find out the pattern of disease that they have, and then you choose the appropriate therapeutic strategy for that patient. And sometimes it leans towards a modality that works a little bit better for a given person or the other. So sometimes herbology will work a little bit better for a given patient, and acupuncture will work a little bit better for another patient, and it's circumstantial. And so you end up being able to use pretty much all forms of the modalities, partially depending on how much you know, and partially depending on the disease that's been identified.
Mm-hmm, mm-hmm. Yeah, of course. What I'm thinking now is like, would it be some general advice from like, I'm sure that everybody would like to hear that, although I know it's never general, it's always individual, but still, like, would it be something, a general advice that you can say, for example, those herbs might help, or or any kind of approach might help better than the other for these women. We have something developing here, like we have a couple of acupuncturists, and we have also some remedies and herbal medicine, some from Chinese herbs, of course, here. So we have something, but I'm still curious to see what would be, for example, some general, if possible, again, general recommendation, what can help.
Well, common scenarios that you might see with patients coming into the clinic will be different kind of diseases that are related to either hormones or gynecology. So you may see something like PCOS, the polycystic
ovarian, yeah.
Yeah.
Endometriosis is also a big topic that we have here. Endometriosis is one of them. Yeah.
Yeah, endometriosis and other kind of conditions like that. And there are certain kind of herbal formulas that can be used in these kind of conditions that have an action to, on a broad scope, have an action to help balance the hormone for a female, kind of optimize their hormonal balance. So you can always apply these kind of methods for the patients, and getting kind of helping them get the hormonal balance and get the good internal landscape for either fertility, or help their body overcome a disease process, or even kind of situate them to get better outcomes with other complementary care. And you can use this methodology too. And so you can use this broader scope of treatment to help this patient base with positive outcome. You can narrow it down for an individual as needed.
Yeah. Mm-hmm. Yeah. Okay. For example, what would be also very interesting to know, and maybe this is a hard question, but for autoimmune conditions, sometimes they're connected with this. Endometriosis, for example, has in US almost got this title of being autoimmune disease. Is still not confirmed, but we have a lot of Hashimoto's, Crohn's diseases, and stuff like that. So how the acupuncture, because like there is this common opinion that acupuncture is great for your immune system, it's great for your balancing your hormones anyway, but for this kind of raising and awakening your immune system, when autoimmune conditions are in background, how this applies.
Mm-hmm. It's a very common scenario, like you just mentioned.
It's difficult. I know that it's difficult, but let's try to explain that, because I have a different experiences with that. That's why I'm asking you as an expert to tell us, is it the case, or how do we work with these patients?
My perspective on it is that Chinese medicine works very well with autoimmune conditions in general. And the perspective around that is something that I'll try to explain. It's the way that Chinese medicine will look at a certain type of pathology. So in autoimmune, you have the body immune system attacking itself for various reasons. And this is a state of disharmony in the Chinese medicine concept, but disharmony is kind of an umbrella term. And so there can be deficiency in some part of the body, and what we term excess in a different part of the body. And so harmonizing these deficiencies and excesses brings back harmony. And in the case of an autoimmune disease, that harmony extends into the modulation of the immune system. There's some very specialized terms in Chinese medicine that I can refer to. One of them is called the nutritive and the protective qi. And this is a little hard concept to explain quickly, but basically in our body system, we have these two kind of responses. When they're not balanced well, you can have something like a warm or an inflammatory response that's inappropriate to a circumstance, and it's caused by an imbalance in the body, and it's attacking other parts of the body. And then you can reconstitute the sources of those two substances by harmonizing the body. So what it comes down to is providing balance to the body by detecting what's out of balance and what's overacting, and then remedying those. So acupuncture works very well for this kind of case, because you're finding out which part of the body is imbalanced, and you're providing a treatment to balance it. Herbal medicine also works very well because it has the ability to strengthen the parts of the body that are weaker, and then the body's immune system kind of not working in a modulated, harmonious fashion. And so you're kind of rebooting the immune system in a sense. You're kind of giving it, grounding it by providing a sense of harmony. I'm just using, I'm trying to avoid using really technical, the Chinese medicine term, but basically this is the approach. And it works very well in autoimmune conditions. And it doesn't really matter what the presenting complaint or disease is. It can have an autoimmune etiology to it, and you can use this treatment to work with modulating the immune system, balancing the different kind of imbalances that the body that are driving the imbalance of the immune system, helping the body go into its own homeostasis, which will be very helpful when you proceed in your treatment for whatever the presenting disease is, or you do that simultaneously. And so it always is very instrumental and helpful in most of the autoimmune conditions that I observed. Yeah.
Interesting, because there are a lot of, like kind of comments like, "Oh my God, I don't need a stronger immune system that I already have. My immune system is attacking my organism, like my body." So these are all the sentences we are dealing with usually. So that's why it's great to explain and to say actually that we are reaching the root cause of the problem and not the manifestation or the symptoms in that sense.
Yeah, maybe I
Yeah.
can offer something. The treatment, when it's done well, when it's based on an observation that's correct, it has more of a modulating effect than it does only a tonic effect on somebody who's already having an imbalance. That person with a hyperimmunity will suffer from a tonic effect, but it has more of a modulating effect, which is promising.
And maybe just to add to that, is every therapist, like traditional Chinese medicine therapist, can do that, or I mean, any who is licensed to do it? Is anyone? Can we go to any therapist and expect to see us in that way, or this is more matter of skills, experience, and to be detected properly?
I think it's inherent in the practice of Chinese medicine. So if the practitioner is practicing authentically, it should be inherent in that system. There will be practitioners who maybe have developed their skills and experience with that, but the system itself should embody that therapeutic action when it's used properly.
Very interesting. Just one short interruption. I just want to say, because there was questions in the meanwhile while we were talking, and I just want to say for those who are asking if there is going to be a translation, it's going to be after this interview. I will put the subtitles there, so there will be translation. So I will just say shortly in my language so they understand. So sve će
No
biti
problem.
prevedeno, ostanite ili pročitajte i pogledajte ponovo ovaj live nakon što ga sačuvamo nakon ovog intervjua, tako da imaćete prevod za sve koje ne razumete, a pitanje možete da postavite isto na našem jeziku, ja ću ih prevesti. Sorry for this. Just wanted to remind everyone that they can ask also in other language, so I'll translate to you. There was an English question there. Do you have an advice? What institution can we choose for starting studies or courses of TCM? What would be the best school to take? Maybe online, of course, since we are not unfortunately in Taiwan or China. But what would be your recommendation for those who want to learn more about it?
Well, I think it depends where you want to be a little bit. If you want to stay in Europe, I think they do have some schools in London, and they have probably maybe Scotland, and I believe in Amsterdam, and so there are some choices right there in Europe. Maybe in the Netherlands too. I'm not familiar with all of the schools there, but I do know a few of them, and I know the schools should be fine, good schools, and you can choose any of those if those are accessible to you, or you can go study in China. There's plenty of institutions that like foreign students and just kind of study where it originated from. Taiwan also has international programs as well that you can reach out to. So I don't know which the school that will be best probably will be a combination of where you want to be, where you can go, and then second is like if you have any particular interest, because some schools have a little bit of strengths and weaknesses. But for your basic traditional Chinese medicine education, I think pretty much all the schools will have a solid foundation, especially if they have a licensing following that, because they have to follow some kind of guideline for that.
Yeah, I thought maybe there's some global, school that it's one name that it's spread all around the world, like some, like some other type of schools, maybe something like that. If you can think of that, maybe we can write this in comments later. It doesn't matter, it doesn't bother. One more difficult question. I'm sorry for that. I mean, you're allowed to tell me that's more of the prejudice than it's really a fact, because I'm amateur in that, and I would also like to know more about it. So for the conditions that have this inflammatory effect, we know that Chinese medicine is based on this warming effect. Let's say they always talk about how important it is to, eat a warm food, or like cause with some herbal medicine to cause some heating effect, and so we know that this is important for traditional Chinese medicine. So how does that go with inflammatory diseases like inflammatory bowel syndrome, or any kind of inflammation, so endometriosis again, or any kind of inflammation we have in the body? How this goes together?
Well, frankly, in a very basic level, inflammation will be viewed as heat. Mm-hmm. And so the treatment strategy, if you view it as heat, or you identify it as a condition of heat in the body, we're usually using some kind of cooling methodology. But it's not quite that simple in the real clinical scenario. There's basically, inflammation can be a product of a lot of different disease pathologies that are going on. And the practitioner would want to identify what kind of disease mechanism is creating the condition for the inflammation. And this becomes something that you need to approach with a differential diagnosis, basically, to handle it properly. So what that means is, I've seen patients that have inflammatory conditions, both acute and chronic, maybe acute cases where they have very serious inflammation, and we identify that as a heat condition. The approach will simply be to clear the heat, and we're using herbs that are cold and bitter and to treat that disease. You can also have patients with long-term inflammatory conditions that have a cold condition. The cold condition is creating the disease process. The product of the disease process is actually the inflammation. The heat is displaced. Actually, it's not like it's either hot or cold. It's actually a derivative, and it's displaced. So we learn how to basically balance the body system again. Sometimes we can use warming herbs to treat inflammation for this reason. Basically, it's normalizing the disease pathogenic factor in one area to reduce the outcome of the inflammation that's affecting another. And the approach is systemic and holistic. So it's when we find the cause of the disease, so very often the cause of disease will be something like in the gastrointestinal tract, for example. And then we treat the gastrointestinal tract. We account for the signs and the symptoms, and we do different kind of differential intake, and we find a pattern of disease, and we treat that to normalize where the pathology is at. And then that circumstance, that normalization, that rectification is what helps the other disease outcomes to improve. So you can actually use multiple methods to treat inflammation. It's not just directly pointed at the inflammation, it's directed at the cause.
Yeah, I have a comment that it's really adding great to that. It says, like, root problem in my case is gut, and using lots of antibiotics from early age. This was also very common in my young age here. Like, everything was treated with antibiotics, and this was out of control. Autoimmune diseases, celiac, Hashimoto's, spondylosis, insulin resistance. Just now that antibiotics are responsible, leaky gut. So that's basically what you just said. So I just said, like, it's fitting very well to that, to what we're talking about it. So maybe when we are on this topic, I will address the high toxicity from antibiotics, or from, like a lot of surgeries, a lot of, CT scans, a lot of all this pollution we have all around, and industrialization that made us prone to different diseases just because of the high toxicity. So what would be some advice that you can give everyone what is something that we can do by ourselves, maybe without going to the therapist now, in order to maybe acupressor. We were not talking about acupressor, which is also a part of the traditional Chinese medicine. So maybe you can give us some advice what we can do in order to help ourselves. Like maybe there is some there are some points or that we can stimulate ourselves.
Yeah, there certainly are. The same situation has occurred in the U.S. So kind of like the Western countries have this problem. You know, maybe 10, 15, 20 years ago, there was so much antibiotic use and other things that it caused damage to people's gastrointestinal tract. And it's mostly viewed as a condition of internal cold with the perspective of Chinese medicine. So they have certain signs and symptoms like bloating, sometimes acid reflux, sometimes loose stools, and it varies from patient to patient. But the center of the problem from this perspective is kind of a cold condition in the interior aspect of the stomach and the gastrointestinal system. When we say cold in Chinese medicine, it's not just a temperature, it's also a lack of physical or physiological vitality, where the organs are not actually expressing their normal physiology fully. So there's disease because of this inhibited physiology. That's part of cold as well. Mm-hmm. So you can approach it yourself by doing acupressure on the channels and points of the body that are more closely related to the stomach and the gastrointestinal system. So, for example, if you have a sick stomach, one of the most common or frequent signs and symptoms will be like the esophageal reflux, like a reflux disorder, acid reflux. In the Chinese medicine theory, the stomach's basic directionality of physiology is to move down. Food goes in the mouth, it moves down the esophagus to the stomach, then it moves down through the colon and out through the bowel movement eventually. So everything's going down. But in disease, we start having something moving up, like the acid in the gastroesophageal reflux. So, well, what that means is when we're applying acupressure, what we want to do is massage the points on the body, on the meridians that have an influence on the gastrointestinal system, to help stimulate their physiology and normalize the directionality of their physiology. And those points are mostly going to be found on the large intestine channel, mostly around the elbow, because the elbow is the area that will help the directionality of the stomach to move back downward again, and around the knees on the stomach channel, or the spleen channel on the inside of the knee, and so on. And these are the ones that are going to work best with the organ system,
Can you show us how we should do it? Like,
yeah. So I can show you on one arm here. Mm-hmm. You bend the arm and you find the crease. There's a small crease here, and you basically go right into the small hole that's near the bone. If you feel around, if you look at the textbook, there's a very definite coordinate, like a line. You don't need to worry about that too much. You go by anatomy. So you want to feel the small hole, or you find a place around there that's most painful, and then you press, and you just make small circles, and ideally you can do that from 1 minute each point. You press in, you hold the depth, and you just make small circles. This is one method, and this is press in and make small circles like this. Do both sides. You can do the one that everyone knows for the headache here. This is actually for the stomach. Yeah. You can do that as well. You do the same thing. You open your hand up wide. You find a depression. It's actually here, and then you massage it. 2 fingers equal the same as thumb if you're trying to measure your strength. Yeah, and do both hands. And then on the leg on the outside, just underneath your kneecap, you'll find a sensitive point there as well. And on the inside of your knee, just on the inside of the tibia bone, you'll find another very sensitive point there, and you can massage these points. You can also warm the hands, and you can.
So we are talking about toxicity. So let's say like the high toxicity, we're talking about the points that we can stimulate in order to like
Yeah,
reduce
help
it,
yourself.
let's say. How much do we how long do we need to do it, or how many
Uh,
times, or
Normally we do like 1 point massage for 1 minute, and you can do that like 2 or 3 times a day, and you do it over time.
mm-hmm.
There's there's actually, to be honest with you, there's many methods, but this is one of the most direct and easy to
Mm-hmm.
do for yourself.
Perfect. Just one more. I mean, it's very useful. All the information you're sharing with us. One more thing, maybe for PMS. Like this is a very common topic here. So PMS. Is there anything we can do in terms of acupressure that to release this pain?
Yeah, most patients will probably do something like find an herbal formula to take, and so formulas like the Xiao San.
Mm-hmm.
And if you're familiar, there's a formula called Xiao San, which is the free and easy wonder. This is very commonly used in gynecology. I think it's probably the most prescribed herbal formula in Taiwan, I think,
Okay.
because the propensity of female health. And you can use this daily, but in addition to that, if the patient's feeling kind of vexed, and if you know what I mean by vexed, like physically anxious and they need to stretch a lot and feeling kind of uptight, you can use another formula called the Ganmai Da Cao Tang, which is the jujube formula. It's also, they call this herbal chocolate to
Mm-hmm.
help with that.
Mm-hmm.
Like if you know the feeling of when you want to eat chocolate helps you relax, the Ganmai Da Cao Tang can be used similarly. And so yeah, so you can take, most of the ladies will like to take these herbs to help, but in addition to that, there's a point on above the ankle, on right along the fibula and the inner part of the leg, about this far. You can put your hand one part right under your ankle, and about the hand distance up, there'll be a very tender point on the inner part of your lower leg above your ankle, and this is
Okay.
probably the most important point to
Mm-hmm.
for a lady. This
It's
is called
smart. Mm-hmm.
Spleen 6, or San Yin Jiao is the name of the point, and it works with all the channels coming up into the female system. So most female can massage this area, and the same method is fine. And you can massage the point on the inside of the leg that are tender. Any of them are okay. Just massage the whole way if you want to, and you can also massage um, the point on the inside here of the arm. It's about 3 fingers down between the two tendon. There's a tender point you can massage in here as well. The reason this one is well known for treating nausea, but actually this is connected to the uterus.
Yeah.
Yeah, a little bit lower, so about
Okay.
two thumbs distance down, about here. There'll be a small depression there, and you can massage in there. Yeah, this kind of thing is very helpful. You can also do that point on the opposite side is good. And
The
you
same
you
spot on
find
the
this
opposite
small.
side. It's the same
Yep,
spot where I was on the,
yep.
yeah.
Literally, acupuncturists put a needle through both, so you can just imagine putting a needle through to locate it. It's easy to do that. Yeah, these 4 points are quite useful for helping with this problem.
Yeah.
Mhm.
I just want to mention, like now I saw the comment from Roska. So we have now here in this part of the world, thanks to her, we have a remedy which is called menstrual, which has also this um, herbs, the Chinese herbs, like Taiwanese herbs actually. So they can, additionally to acupressure, I'm sure that they can be very useful.
Mhm.
So I have just a comment. So maybe just that to read if I find it now, because there are new coming about the schools in Europe. Oh, I think she wrote, but I lost it.
I see on my side something about the Dutch Academy
Yeah, Dutch Academy. Yeah, so that's something, some recommendation from somebody who did it in Netherlands. So
called Dutch Acupuncture Academy in Amsterdam.
in Amsterdam. So that's the recommendation. So I'm sure that's a good school because we have Roska was studying traditional Chinese medicine in Netherlands. Okay, well, there are I would ask 100 questions, but I don't want to. I mean, I'm very grateful for your time, first of all, to share all of these informations with us, and it's really, really interesting. Maybe you can tell us, is it possible to work with you online, for example? Is it possible? Do you do that, or you're just doing in your practice in Taiwan patients?
I especially because of COVID, everything got closed down. And at least where I was in the States at the time, I did end up doing a lot of telehealth, and I still do it because it became a new way of reaching out to people. So
Yeah.
yeah, if anybody's interested, you can just reach me right through this IG, I guess. On my channel is called the Greg's TCM Tea House. Yeah, you can post it out
Perfect.
there if anybody's interested, or if you have questions about stuff that I can help.
That's great. Thank you so much, because I have, I mean, also it will stay, this conversation that we had today will stay on my profile. So anyone can see your profile and contact you, or write to ask some questions as well. So we can both to see that and answer that after this video. Yeah, so I'm really again, very grateful for this conversation and for your time to share this with us. It's really interesting, and there are a lot of things that we can cover. And I really hope to meet you live. So maybe sometimes somewhere. But nevertheless, thanks a lot. And yeah, and we will contact you again soon. I'm sure it will be a lot of questions and interest to talk to you further.
Oh, great. Yes, my pleasure also. I'm happy to offer any help that I can. And it was very nice to meet everybody on Instagram Live.
Thanks, Greg. One more time, all the best to you. And yes, I will just switch to my language and say that možete da, znači, postavite pitanja, postavite na našem jeziku, ja ću svakako to prevesti. Ukoliko ne želite engleski, i Greg nam je tu, bit će njegov profil vidljiv na mom, njegov, znači, Instagram nalog će biti vidljiv na mom profilu, i ovaj video ostaje za vas tu sa prevodom nakon ovog intervjua, tako da, eto, hvala vam što ste svi bili tu. Thank you, Greg, once more, and hope to talk to you soon.
Yeah, likewise.
Thank you. All
You're
the
welcome.
best to Taiwan.
Yeah.
Bye-bye.
You too. Bye-bye.
Bye-bye.